I think it is critically important for all pain clinicians, who in my mind are all pain educators, to understand the basic principles of instructional systems development or instructional design. For example, in my session yesterday, I shared the ADDIE model, ADDIE, which is analysis, design, development, implementation, and evaluation. One of the most important steps, and the step that people overlook most often, is analyzing the audience. So if, for example, you've agreed to give a presentation, it's important to find out who's going to be there. What is their educational background? Why will they be there? What are you trying to accomplish? What do they want to get out of it? It's important to know, am I speaking with lay people or am I speaking with cardiologists? Because that completely changes the nature of my educational design. Then you design your materials, you develop them, you implement them, and throughout the whole process you implement evaluation. You evaluate your analysis, you evaluate all the way straight through to the outcomes of the program. We have 4 levels of evaluation. Level 1 are what we call the smile sheets. Did you like the program? Did I meet my objectives? Did you like the snack that we had for lunch, for example? Level 2 is knowledge. So I could give someone a quiz saying, okay, now that we've talked about pain, please tell me what are the 8 elements of symptom analysis. Level 3 is, due to my education, do these clinicians go back and do things differently in their practice now? And level 4 is the holy grail. Are patients achieving better outcomes because the practitioners are doing different things thanks to the education that I implemented? So I do think it's important for all pain clinicians to be able to use these principles of educational design, whether it is a program they'll be implementing in the future at some point and they have time to design it, or to at least be aware of these principles when they're teaching on the fly, so to speak. So if a patient comes up to me, a colleague comes up to me and says, hey, could you tell me about that new drug? I need to think through immediately, who am I talking to? What's their educational background? Why do they need to know this? How's the best way to explain this? And then also to get a little feedback at the end. So I think it's very important for everyone to at least possess the basics of instructional design, whether it's a planned event where you have time to put some thought into it or on the fly.